How's my hair look? Is it all right? Look good? 5 more things you need to know about Obamacare in Ohio for 2014. How's it going, everyone? I'm Joey Giangola with Giangola Insurance, and today we're going to go ahead and give you 5 things that you need to know about Obamacare healthcare reform, the Affordable Care Act in Ohio coming up here in 2014. If you remember a while back, probably about a year ago, I did a first initial go around of 5 things that you need to know about healthcare reform. You can check that out right here if you want to catch up on that list. So I thought, what better time than now to go ahead and put 5 more things on the table for you to understand with everything that we need to know. There's a lot of unanswered questions still, a lot of the more important questions that still have yet to be answered. First, number 1, October 1st is when Ohio's health insurance marketplace opens its virtual doors. That means that's going to be the very first time you're going to have the opportunity to purchase a potentially heavily subsidized health insurance policy. These subsidies will be provided by the federal government and based on your income. Number 2, network nonsense. Now, I can't fully talk about in extreme detail some of the things that I already know about what's forthcoming here and the changes some of these health insurance companies are making. There'll be plenty more on that as soon as I am actually allowed to discuss it in detail with you. You really are going to need to pay attention to these networks of doctors and hospitals moving forward. Just because you had health insurance with a company pre-Obamacare does not mean that that health insurance company's network is going to be great and fantastic post-Obamacare. There's going to be, from what I can tell, a lot of goofy things going on. So you're going to want to make sure that you have access to all the major hospital facilities, all the doctors, and everybody that you would prefer to receive care from. Number 3, your income is number 1. So how much do you make a year? What's your family household income? Now, I'm not asking you to actually answer that for me, but that is going to be probably one of the very first questions that you're going to get asked when you're looking to buy health insurance now in this marketplace world. Don't panic. It's okay. You're going to want to be as accurate as possible with that answer because that's what's going to go a long way to determining what health insurance path you should take. If you do qualify for those tax credits and subsidies, you will find it almost impossible to buy your health insurance outside of the marketplace. Number 4, effective dates. Remember when I might have told you, somebody else might have told you, but hey, don't worry about it. The day you get your application in, it will be retroactive to start and whatever day you apply. No siree, not anymore. That is a thing of the past. Retroactive effective dates are retro. Who writes this garbage? I mean, I got to say this stuff. I got to go and talk to these people and give the... And how it's going to work moving forward is day that is basically your cutoff date is going to pretty much be the 15th. So for this first initial enrollment, which is October 1st to March 31st, so you got 6 months. The first 3 months of that, from October 1st until December 15th, will get you a January 1st effective date. If you apply after the 15th of any month following December 15th, well then your effective date will be determined upon that split. Let's say you apply on January 12th of 2014. Your effective date would then be February 1st of 2014, which that means you've only got a few days, 15 days or so without coverage. However, if you apply after the 15th of any month, again, we'll use January as an example. Let's say you apply on January 23rd and your effective date will not be until March 1st of 2014, essentially leaving you with a pretty big gap, but 45 days, give or take, depending upon when you actually get that in, that you have to wait for that coverage. Also, they're going to be pretty stingy on this with very few exceptions being made, if any. I doubt there's going to be any, so don't plan on there being any. And number 5, no more pre-existing conditions. Well, if you went back and read the previous list that I mentioned earlier, yeah, I know, it's on that list too. But guess what? It is that important that you need to hear it twice. You can probably hear it 18 times. This is one of the biggest things that you're going to want to pay attention to outside of the enrollment dates and the tax penalty. But the fact that pre-existing conditions no longer exist when you start applying for plans October 1st is going to be a ridiculous game changer for a lot of people. If you've been struggling to get coverage for many years and have been unable to do so, well, this is going to be your opportunity. Likewise, if you've been stuck at a job simply because you want to hold on to those health benefits, well, then that is no longer going to be the case. You will be able to purchase a plan on your own, regardless of those pre-existing conditions. and for those subsidized premiums, assuming you qualify. So, well, what's the bottom line? Well, the bottom line is that I don't know that anybody is truly ready for what is going to happen here come the start of 2014 or even October 1st when the marketplace is open. What you're going to want to do is make sure you focus on the kind of three pillars, if you will, of your health insurance coverage. Again, those are your price, your coverage, and your medical treatment. If all three of those things are okay with you, then chances are you're making a fairly smart health insurance decision. Do your best, however, to avoid all the silliness, nonsense, false information. I know it's hard to spot because no one really knows what's going on, but do yourself a favor, work with somebody that knows what is going on, is going to save you the time, effort, and energy to make sense of all this and really just help you get this right the first time. Because if you screw up and you miss the window and you don't do something the way that you were supposed to, well, you're going to regret it for the entire year because you will not be able to do anything about it. So if you want to go ahead and take a little bit of a deeper dive into some of the more important questions surrounding Ohio's health insurance marketplace, I would encourage you to go ahead and download our very free ebook. It's very free. How to Understand Ohio's Health Insurance Marketplace. This is going to go ahead and answer all those questions for you, give you the best information that we have available right now, plus walk you through the application step by step. But if you want to go ahead and grab this right now, you can click on this ebook cover right here. Just click on it, click, and it will go ahead and take you to a page to download this. If you don't feel like clicking on the video, you can go ahead and grab the link down below in the video's description. So I just wanted to thank you real quick for taking the time to watch this video. If you did find it helpful, feel free to click the like button, but I do appreciate you taking the time. Of course, as always, I am Joey Giangola with Giangola Insurance Agency. Take it easy, everyone.